Hello and welcome. My name is Amir MD. I'm an orthopedic and hand surgeon. Today we'll be talking about a dislocated PIP joint. This is a proximal interphalangeal joint here of the finger. As you can see, it was dislocated, or should I say subluxated. That means that there is at least some area here where there's a little bit of contact between the two joint surfaces, but it is still a dislocation, what most people would regard. I will start with a disclaimer here and tell you that this is not medical advice that should be used. It's just a general advice, and I still really think that you should consult with a physician, hopefully a hand surgeon or someone who knows what he's doing about the hand. But we'll talk about what to do with these cases if you're stuck somewhere or you need help with it. So this is your joint, and a line joint will look like this, and this is a dislocated joint. At this point, this is the fifth finger of the left hand of the patient I have next to me, and we'll talk about that in a moment. Okay, so what I will do now is I will show you the finger after it was relocated, and in actuality, this finger here was put in a straight splint. This is one of the reasons I'm not completely for it. What you see here, there's a small area here which is an avulsion fracture. This can happen, and if this is a big one, your joint might be unstable, and that is a cause for alarm. In general, putting the patient in a splint which is straight off is not what I recommend. I usually recommend putting him in a splint which is about 30 degrees angled in flexion, which means that your finger will look just about like this and not be straightened out. Why? Because the avulsion fracture, this exact area here, will stick to the bone in a better way this way. After we do this, you can do this for about a week, or you should also be able to be flexing down the finger while you're doing this. But at this point now, we have a patient who had the dislocation, and we will see his finger. This is the fifth finger. You can see that the PIP joint is swollen. It was completely off when the injury happened, and this usually does happen on the fifth finger. That's the most common. As you can see, I'm flexing the finger down gently, and I'm asking him to do it himself, but he's in much pain. So what we'll be doing now, as you can see, there is a hematoma down here. You'll see some bleeding after some time. The blood will go down the finger, along the tendons, and I will ask him to, and what you see now is him actually reacting to the pain when I'm flexing down the joint, because he was straightened out for a long period of time, and the fingers next to it, they are completely free. What I suggest doing at this point is actually just buddy taping, putting both fingers together. You can put something between the fingers, buddy tape the fingers, and slowly have the patient move the fingers along and regain the mobility here. What will happen to this little minor fracture here, this avulsion fracture? The avulsion fracture will probably heal into place, and if it is less than 30%, or let's say 20% of the joint will usually be stable, and we are happy about it. If you see that there's a subluxation, meaning this part moves above the other area, or you feel that your finger is popping in and out all the time, you might have an unstable joint. It will probably be very painful, and this will probably need surgery, which is not a simple one. So when we go back to the finger, after, let's say, a week, you had it splinted, you were still flexing it down to some extent. Now you can buddy tape the fingers and have the fourth finger, or the finger next to the one that's injured, take down the other one, and you slowly regain movement, because movement is important for your joint and for your health. Usually this will heal, and you will regain your full range of motion, okay? And it takes some time, patience, but this is a dislocation of the finger. It's not a small injury, but it's an injury you can recover from. Thank you very much for your attention. All the health to you.